A few months ago, the coronavirus was a localized outbreak in Wuhan, China. Today, COVID-19 has exploded into a global pandemic that has governments worldwide placing their countries under lockdown. Hello, I'm Linor Moudou. Welcome to a special edition of Straight Talk Africa on the coronavirus. The ongoing COVID-19 pandemic is posing a global challenge never seen before in this century, as health authorities around the world are grappling to contain the outbreak. Confirmed cases of the virus have surpassed 1.3 million globally, and more than 73,000 have died from the viral disease. Now, the good news, over 270,000 people have recovered. In Africa, COVID-19 has infected at least 9,000 people. More than 400 have lost their lives to the virus, but over 900 have survived. So far, Africa has the world's lowest burden of COVID-19 cases, but the virus is showing no signs of slowing down. As the coronavirus spreads, so do myths and misinformation. Today, our experts will address some of them and answer your questions. But first, countries across the continent have imposed a wide range of measures to prevent the spread of the coronavirus, including closing schools, imposing travel restrictions, and curfews. Straight Talk Africa's Paul Ndiho has the details.
Most of the world knew little about COVID-19 last December, when reports of a new deadly virus started to surface in Wuhan, China. Since then, however, it has spread across the world, disrupting daily lives of millions of people. Many of them are now under lockdown measures meant to slow the spread of the virus. The highly contagious coronavirus is now threatening to spread across Africa. Dr. Amita Taka is the chairperson of the Nairobi-based Africa Health Business. He says Africa requires a united approach to fight COVID-19.
I think everyone, government, private sector, civil society, development partners are all on the forefront and preparing to ensure that we flatten the curve. As you know, the ability of our health systems is even weaker than many of the countries that have faced high levels of mortality.
The World Health Organization says the impact of a major epidemic across Africa could be devastating. Most of the continent's healthcare systems are still ill-equipped to care for what could be an overwhelming number.
We should scale up our preparedness, but let's look at Kenya, for example, where I am. Our president and the Minister of Health leading the government efforts are totally on the ball about what's happening on corona. The private sector has regrouped itself in an organized manner to provide the support it needs. There are measures being taken to try and prevent transmission. As you know, in Africa right now, we are focusing on the big three goals. The first goal is prevent transmission. The second goal is prevent death. And the third one is preventing social harm. All our activities are geared towards these three goals.
COVID-19 has killed tens of thousands of people, according to Johns Hopkins Medical Center, but over 270,000 people have recovered from the disease. Dr. Laura Tani Rimac, a family physician based in Saskatchewan, Canada, says Africa is still ground zero, even though medical professionals and governments are doing their best.
There are three steps. It's testing. It is also having access to the result. And then if you have it, you have to be staged in terms of severity and treated. But also if you don't have it, we want to prevent you having it. Or if you have mild symptoms, then you also have to be socially isolated to prevent its spread.
Dr. Tanya Rimac warns that Africans need to change their mindset.
That this virus is aggressive, it is a killer, it is a paradigm shift. It is not about panic, it is about calming down to realize that this virus it travels in the air, this air that we all breathe.
Many countries are facing a severe shortage of masks and other personal protective equipment. as the coronavirus infects more people and claims more lives. Social media outlets are teaming up with countries on the continent to fight the misinformation about COVID-19 on social media platforms. Paul Ndiho, VOA News.